Hey guys, Dr. Alex here, and in today's video, we're gonna talk about being shifted. We're gonna talk about forward head posture. We're gonna talk about a new study that came out this year that, thank God, confirms everything I've been saying to patients for years. And we're also gonna talk about why forward head posture does not always equal pain, and that forward head posture, the concern with being shifted is that it affects your health, which means that it affects your function and your well-being. So let's get into it. So by far the most irritating thing I receive on Instagram or on social media is when I say, make sure that you have good posture, make sure that your spine is healthy, structurally intact, ears stacked over shoulder, and invariably some other manual therapist will send me a message like, oh, posture doesn't matter, or oh, having forward head posture doesn't matter. And I think to myself, are you insane? And they will say back after I give them some research and some things to read, they're like, oh, but it doesn't cause pain. And they're right. Forward head posture does not necessarily cause pain. And that's because pain is really complicated. You could have cancer, you could have all sort of different health problems, and you might not feel it. You might not have any symptoms. You might not have any actual pain. But in our office, we don't focus on pain. We don't focus on symptoms. We focus on health, which is the optimal function of all the cells, organs, tissues in your body. We want to make sure that you are functioning optimally. So when we think about forward head posture or anterior head carriage or whatever you want to call it, when we think about this, I'm always thinking about how it's going to affect your function, your health, your well-being. And so what this recent research paper says is it talks about a few things. If your head is forward, if it is shifted, there's a couple consequences. So number one, they talk about breathing. They talk about with a forward shift in the head, that anterior spinal shift, they make a note of how it changes breathing. It makes so that the lower part of the lungs can't expand as much because the lower rib cage doesn't move. It talks about how you end up breathing more with your chest, which causes more tightness through the sternocleidoid mastoid and the anterior scalenes, which in my experience perpetuates that even more. They also talk about how, for all my cycling friends out there, if your head is shifted, it changes your performance in terms of your lungs. Some of the vitals that they do with spirometry, measuring the exchange of gases in and out of the lungs, the flow of gases in and out of the lungs, it's altered and it's worse performance for those who are shifted forward. If I was a cyclist, if I'm an athlete, I don't want that. I want to make sure my neck is nicely stacked up, that I'm not using over and over again these muscles that assist in breathing, that if you're trying to perform at your best, they're stiff, they're tired, the lungs don't move as well, and you're not going to get as much oxygen to those moving tissues that are needed to perform. They also talk about in this study about something called proprioception, which is your body's awareness of itself in space. It's basically the ability to know that when you bend your finger, you've bent your finger without having to look at it. That's the most basic sense. So they talk about in this study that when the head shifts forward, when that's the resting position, the muscles in the base of the skull and the back of the neck that are really, really important for balance, that are really, really important for telling your brain how your head, how your body is positioned, they don't function as well. Something called the muscle spindle in those muscles that gives feedback to your brain about how your body's moving, it doesn't work as well, so your brain does not have a good awareness of how you're positioned. Now, I'm going to let you guys all on a little secret. When you see a chiropractor, when we go through our corrective care process with a patient and we take them from here to here, it's not because I'm putting joints back into place. It doesn't work that way. What we do is by restoring normal motion to the joints in the spine, by making sure that the brain-body connection is working properly, to make sure that all of those proprioceptors are sending the right signals, what happens over time is that the spine basically realigns to the normal, natural, healthy position because your brain's awareness that this is bad and that this is where it should be slowly becomes the new normal. So in this study, they talk about how balance is better. They talk about how proprioception is better when the head is stacked up. And they do make a note that the more shifted you are, the worse that proprioception actually is. Now, in this study, they actually do make a note about forward head posture, anterior spinal shift, and neck pain. In this study, they make a note that there is a positive association between it, saying in other words that if the head is shifted forward, you're a little bit more likely to have pain. Now, this is complicated because pain does not always reflect when there is a problem. We can have lots and lots of patients where they have an unhealthy spine, where I go and I examine or challenge a joint in their spine, and not until I challenge it, or they challenge it themselves with exercise or with stretching or mobility, not until it's challenged do they feel that there is a problem. And that's, an inherent flaw in the body. We are built for survival. We are not built to be optimal in terms of our pain and sensation system, which is kind of a good thing. It's not like you get a warning light going off every time you have some McDonald's. But a problem with that is that, if there's a joint in your neck that's shifted or irritated, you're not always told about it. So I totally get that not everybody that's going to have anterior spinal shift is going to have pain. But in my experience, what I do know and what we do see in the office, that if you're taking care of somebody's case, their head is shifted, if you want to help them reach their goals of being neck pain free and staying neck pain free, fixing that underlying structure in the spine is really important. And I think last but not least, one thing I want to touch on that we know from other studies not mentioned specifically in this one, and something we see all the time in the office, is that the association between the neck and the shoulder is very strong. That if somebody's neck is shifted forward, we know from this study it talks about how the muscles in and around the neck don't work as well. And that includes the muscles that go down into the shoulder. That includes some of those 17 or 18 muscles that attach onto the shoulder. If the head is shifted forward, it is going to change the relationship between the neck and the shoulder, both in terms of how those nerves function, how the muscles function, and how the two work together to function as one with, say, an overhead lift, or simply with sitting and studying or working at your desk. So the purpose of today's video is to let you guys know that where your head is positioned is important. Now, there are a couple ways about going about correcting it. Can you fix this problem yourself? It depends. If the underlying spine is unhealthy, if there's an underlying problem, if the joints and the nerves of the spine don't work well, it's going to be exceedingly hard to fix this yourself. It is going to take months and months of diligent exercise and rehab, and you might get there. The reason I don't know if you will or you won't, it's not a lot of research, and in our office, I don't have any feedback for you, because if we find this problem, we help people fix it. I am going to include all the stretches, all the exercises in the description below of what you guys can do to help yourself with this problem. But if you think you have this problem, I recommend go get it checked. If you have this problem and it's simply an issue, just an imbalance in strength, if it's just too tight here, not strong enough through the spine, then the exercises, they're gonna work really, really, really well. But if the shift forward is collateral damage or a consequence of an underlying spine, it's gonna be exceedingly hard to fix it yourself, and that's when you should see a professional. But with everything that I do, I'm always gonna give you, ladies and gentlemen, the tools to try and fix it yourself, and if it doesn't work, then you know who to go and see. So guys, thank you for tuning in. Like and subscribe if you want more content like this. If you have any comments, questions, concerns, please leave them below and I will do my best to answer. And remember, keep that spine stacked up, ear over shoulder. Have a great day.